Hello, my name is Lila LaBeouf, and this is the EDS channel. I'm talking to you today about EDS3. Have you heard of EDS3? Maybe you've read about it on eds3.org. EDS3 is a simpler way to refer to Ehlers-Danlos Syndrome Type III Hypermobility. There are actually 14 types of Ehlers-Danlos syndrome, and 13 were established by a committee in the year 2017. Those are the only 13 that I understand and know about. I haven't found that 14th one yet, but I've heard it exists. EDS3 and classic EDS are the two most common forms of Ehlers-Danlos syndrome, but I have EDS3, the hypermobility type, and it's a rare genetic disorder that affects your whole body. If it's something new to you, it affects your memory too. So that's why I'm sorry I can't remember everything I'm supposed to tell you, but I have notes to help me. The problem that EDS patients face is the production of collagen. That process malfunctions in our body. And if you hear the word collagen and you think, oh, that's just cosmetic, it's only superficial skin, and it doesn't matter, I'm afraid you're in for a surprise and not a good one. Collagen is in 90% of your body. So if your collagen is malfunctioning, your whole body is malfunctioning. The first time that I watched a YouTube video about EDS3, my mouth fell open in shock because I couldn't believe all of the symptoms the speaker listed were things I had had throughout my life, dozens of symptoms. And I had no idea they were all related to one disease, that I had one problem that was causing all of these diverse problems in my body. So to give you an example, I'd like to give you a quick rundown of all of the symptoms I'm experiencing right now, today, as I speak. First of all, like I said, it affects your memory. I don't know why my glasses are crooked. It affects your memory, and it affects it gives you chronic fatigue. I know people say chronic fatigue a lot, and it seems like it's something that is overused. I can't help it. It's the truth. I am so exhausted that it really taxes my body just to get up out of bed to go to the bathroom or to go to the kitchen. That chronic fatigue makes me so exhausted, and yet I can't sleep a wink. I have to use two different prescription medications just to fall asleep, and they only keep me asleep for about 3 or 4 hours. That's all I get. I've been up since 4 this morning, and that means I slept in, because usually I wake up at 2:30. I also admit that I have kinesiophobia. I don't agree with the definition of kinesiophobia. Kinesiophobia is defined as an excessive and irrational, an excessive and irrational fear of movement for fear of re-injury or pain. I have that paralyzing fear. I know for a fact it's not excessive, it's not irrational. It is an absolute fact in my case that the more active I am, the more likely I am to have an accident or an injury. It's simple numbers. When you The more you're up and doing something, the more likely you are to have something bad happen to you. It sounds negative, pessimistic, whatever. It's the truth. So, you know, I'll accept that and move on. Um, Knowing that pain is just around the corner, more pain than I already have, which is extensive, gives me chronic anxiety. But chronic anxiety is not a result of the other symptoms. Chronic anxiety is a symptom of its own of Ehlers-Danlos syndrome. And it creates panic attacks. I told my psychiatrist that I had these panic attacks, and he says, "You don't have good coping skills. You need to talk to a therapist and learn how to cope with the things that are bothering you." And I said, "I have panic attacks wake me up from a dead sleep at 2 o'clock in the morning. What am I supposed to be handling or coping with in my sleep? What do I do in my sleep to prevent a panic attack?" I don't know. He didn't have an answer for me, and I've yet to find anybody that does. I also have terrible headaches. There are, I think, at least 6 migraine types that are associated with EDS3, and they can all be happening at one time. One of the ones I have right now that's killing me, my head is too heavy for my neck muscles to support. It doesn't hold my head up, and so it squashes down on my spine and causes tremendous pain in that area of the base of my skull where my spine and my brain combine, and this causes symptoms of its own. First of all, the pain radiates through my head and into my face. My eyes feel like they're bugging out of my head. My eyebrows or my brow bones are sensitive to the touch. They feel like I need to massage them to try and relieve them, but if I touch them, it hurts. So that also causes a lack of balance and a loss of coordination. So just the simple act of walking on an even, level floor will can result in an accident for me because I lose my balance and I have very little coordination. That has gotten me ridiculed throughout my life. They've called me spastic. They've called me clumsy and Calamity Jane and, all of these names that indicate that I can't put one foot in front of the other. They're right. I don't like it, but they're right. Um, I have another headache that's radiating through my shoulders, and my jaw joints are so sore. Have you ever chewed gum so long that your jaw joints just ached? Well, I feel like that 24/7, and I don't chew gum anymore. I suck on breath mints instead because I can't chew the gum. It hurts too much. Um, it makes my hair hurt, and I realize that sounds stupid. My hair doesn't literally hurt, but my hair makes my scalp hurt. It feels like I've got too much hair, like I need to shave my head to get relief. You'll notice I have very droopy eyelids that make it look like I only have my eyes halfway open. It's not because I'm being lazy. I can't lift them any further. The skin sags over my eyes, and that's one of the symptoms, and it's one of the things that my doctor noticed when he made his diagnosis of EDS3. I have tinnitus ringing in my ears. I have the aching jaw joints, and in my mouth, I have a mouth full of problems. I have cavities, bleeding gums, dry mouth, extreme thirst. I'm so thirsty all of the time. I can't go anywhere without a drink. And I have difficulty swallowing, not liquids usually, but food, anything dry especially, but most food. I have to be very careful when I chew food. I have to have enough saliva built up to be able to swallow it, or I have to put something that's smooth and creamy with it to make it go down easier. I also have extreme temperature intolerance. I can't take heat and I can't take cold. And that's a problem because when you have muscular skeletal pain everywhere, that means every muscle, every bone hurts. I need to be able to put heating pads and ice packs on my joints and different muscle groups, and I can't stand the temperature. I can't tolerate the temperature, so I can't tolerate the treatment that would help me feel better, which is a problem. Um, I'm sorry, I need something to drink and I don't have it. Uh, um, I get dizzy when I stand up. Um, everything starts to go black. Some people with EDS3 faint when they stand up because we, okay, I don't know the science. It just happens. People with EDS3 have a problem with fainting when they stand. I have the intense neck pain that goes through my shoulders and makes my shoulders ache. And because of what's going on in my neck, my right arm is so weak that I can't even lift a drink to my mouth. So I'm thirsty all the time. I have to drink with my left hand because my right hand doesn't have the strength to lift the weight of a cup with liquid in it. Pathetic. Um, Sorry, checking the notes. I have pain in my right elbow and wrist. How could I forget that? Uh, Along with when I try to lift a drink, the pain in my right wrist and my right arm, elbow is just crazy. Um, I have a skin problem right now on my right wrist. It's this area here. I don't know if you can see it. Uh, it's a little red, not very red, but it's a little red, and it's dry, rough, and flaky. I've never had that before in my life. I have always had extremely smooth, creamy, velvety skin. My face, my hands, arms have always been very soft to the touch, to the point that it shocks people when they grab my hand or shake my hand. They make a comment about how soft and smooth my skin is. I can't say that anymore about myself because of this stupid skin condition, and it's been going on for about 2 years. Doctors have not given me any answers for it. They're just like, well, just try this and see what happens, and nothing happens. So I have tried all the creams and lotions and medicine, and it's still there 2 years later. Who knows why? I have numbness and tingling in my left wrist and hand. It's also coming from my neck. Um, it is it's my hand is asleep all the time, even when I'm using it. Usually, if you move your foot or your hand when it's asleep, it'll wake up and it'll stop with the tingling. Doesn't happen. I am still have the pain of being asleep. My low back pain is it's intense. It's due to degenerative discs and arthritis, but the arthritis is in every joint that I have. That's part of the EDS. My low back pain, I had a fusion surgery 3 years ago. Before that, I knew that I had EDS. I had my vertebrae fused together, and they removed the disc in my lower back region. But when you take out when you when you lock a joint into place, then the joints around it have to take up the slack for that joint that's not working. They have to work harder and in an awkward position that they're not meant to be in, and then you have more problems. I don't know if it was worth it to have the surgery 3 years ago. I know that I felt like my back was going to snap in half every time I stood up. Um, and I felt like it was completely unbearable. And that's why I got the surgery. But, it created more problems. I don't know if I would do it again. Um, Nausea. The craziest things makes me nauseated. Pretty much everything makes me nauseated, but water, oh my goodness. Everybody's telling me, drink water, drink more water. You need to hydrate yourself. Don't drink soft drinks. I cannot drink water, plain water. Um, I have to have it, in another form. It has to be water that's had tea bags in it to make tea, or some flavoring put in it, or sparkling water. But I cannot drink regular water, and it's expensive to get sparkling water or mineral water. So popcorn makes me nauseated. Who gets nauseated from popcorn? Anything creamy, anything greasy, anything acidic like tomatoes. I love the food. Can't eat it. Can't eat it. It is not going to go well in my stomach. I will end up vomiting. I also have trouble with bloating, gas, diarrhea, and delayed bowel emptying. None of these things are things I would ever like to admit in public, but I'm telling you so that you know this is part of having EDS, and it is symptoms of one disorder that goes along with all the other things I've said already. I also have a skin infection on my bikini area. Another thing I'd not like to say in public. It's a rash about this big going from my abdomen to my thigh, and it's like a yeasty skin infection. Disgusting. I hate it. I hate it. Um, oh my goodness, muscle spasms and cramps. The muscle spasms and cramps are like Charlie horses, but they strike all over my body. It'll hit my toes all of a sudden, and my feet will draw up and contort in these crazy positions that I can't even undo. And then I'll have them in my thighs, my calves, my arms and hands. My throat will contract and feel like it's pulling my chin down. My face will contort. I have all these spasms. Who gets a muscle spasm or a Charlie horse in their face? It's crazy. But I have it. And it's all due to EDS, especially EDS3. I have my right leg, starting in my hip, going all the way down to my toes, is sharp pain. It's just a critical pain. I have extreme pain in my right ankle and weakness in my right ankle. And because my right arm is so weak, I can't support myself on a crutch of any kind. No crutches, no cane, no walker, because my arm can't hold me up. And so since I can't put weight on my foot or my ankle, I'm in bed 90% of the time. I am bedridden. 90% of my life is spent in bed. I have severe pain in both feet, and I've had it since I was 6 years old. Didn't know what it was till I was 47, but I've had it since I was 6 years old, and I itch everywhere. You may have noticed me scratching. If this sounds like your life, I am so sorry. I totally understand. I get how you feel. I know what you're going through emotionally and physically, and I'm so sorry that you have this. I live between Baton Rouge and New Orleans. I live in an area with a lot of educated people, and I constantly meet doctors, lawyers. I don't care about the lawyers. Doctors, nurses, dentists, therapists, physical therapists, emotional therapists, behavioral therapists, um, friends, family that know nothing about EDS or EDS3. They have no idea what it is or how overwhelming its effects are on us. It's called an invisible disease because people who have it look healthy. Don't I look healthy? I don't look like I'm sick. I don't look like I'm crippled and completely disabled, but I am. And people don't get that. In fact, most doctors, when they see me, they assume because I'm overweight that I have high blood pressure and and diabetes and high cholesterol and triglycerides and thyroid problems, all of these diseases that are associated with overweight. I don't have any of that. I have absolutely not one of those things. But the things that I do have caused by EDS keep me bedridden 90% of the time. If you've been diagnosed with EDS, I have good news and bad news. And if you love someone that has EDS, I can teach you what to do to help them. If you are a healthcare provider, whether it's traditional Western medicine or if it's alternative medicines, Eastern medicines, uh, um, essential oils, naturopathy, uh, massage, acupuncture, whatever it is that you believe in, please do your homework on EDS. Learn all you can about EDS. As for the good news and bad news for people who already have it, if you've been diagnosed with EDS3, that's good news. That means you have actually found somebody who knows what EDS is and recognizes that you have it. That's the first step. That's wonderful because now somebody recognizes what's wrong and can start to work on a plan to help you feel better. And to at least know and be validated that all of this time you haven't been lazy, you haven't been looking to get out of stuff, you haven't been just, you know, disinterested in life. they'll finally recognize what's going on with you. Now, the bad news. I told you there was bad news. The bad news is there is no cure for EDS, and it is hereditary. So there's nothing you could have done differently to keep from getting this disease. You can stop, you can keep from passing it on to someone else by not having children or some other, I don't know what the science is in that department anymore. Um, you would have to talk to a reproductive specialist or a geneticist. If you're watching this video to learn more about this mysterious disease wreaking havoc in the life of someone you love, then thank you. Thank you so much for caring enough to learn what is wrong with your loved one. Your loved one will no doubt absolutely need your support emotionally. And depending on how bad their case of EDS is, they may need your help physically. I need help with cooking, cleaning, doing dishes, doing laundry, the things that people think I was trying to get out of, thinking I was lazy. Those are things that I can't do because of EDS. And whether they acknowledge it or not, it's the truth. I've compiled information for each group, for the medical community, the healthcare providers of whatever shape and form, the people who have EDS, and the people who love EDS. I've provided information on EDS3.org, O-R-G. Go there and learn what you can. I will continue to publish information to help each person in those groups. That is easier for me than doing videos. Doing this video is wearing me out. I am exhausted, and I can't always put on makeup and look nice for you. I'm sorry. I'm sure that before long my videos will be without makeup because it's just so much effort that goes into it. So please go to EDS3.org, continue to learn, and I will promise to give you information that will help you. And for those medical people, learn all you can from. There are research studies that are published in peer-reviewed journals that are available for free on the internet, and it's in a tremendous supply. Please do it. Look at it. Read it. Understand what's happening so you can help. Thank you, and I hope you feel better.